Good evening, everybody. This is Dr. Radialis from the Georgia office. I thought today I wanted to talk to you about a very recurrent subject, 40 plus and trying to get pregnant. I think that this population faces a few issues, and I'm sure some of you will listen to this live at one point and feel identified one way or another. Let's talk about a few stigmas. In the general medicine community, medical community, past 35, your advanced maternal age. That's a pretty rough thing to swallow. And then once you're 40 and beyond, you are considered kind of over the reproductive age time. And God forbid you're trying to get pregnant at 50, you're looked upon like you're absolutely crazy and insane. Am I right? So it happens to be that the population that I personally serve tends to be 40 plus and trying to get pregnant. And they encounter not only like personal challenges, biological challenges, but even challenges with the doctors they seek to help them. So let's break up a few of those barriers. What happens? So yes, there is a natural decline on ovarian reserve, especially after 40. It is pretty exponential after that age. That does not mean that you cannot have babies, and that does not mean that you cannot use your eggs. Okay? So then let's break that down even further, right? Everybody's unique. You might be a certain age, but biologically, you actually could be either older or younger. Okay. So if that is in your heart to still be youthful and be like in a moment where you're ready to even start or expand your family, don't let that stuff mess you up. Okay. I am very pleased, honored, and grateful to be part of a company that we're not here to judge you, we're here to help you. And that is aligned with my own personal values and thoughts. So I'm using 40, but it's kind of around 40. I do have people in their late 30s with low ovarian reserve that are behaving like they're in their 40s. Okay. I just worked with a beautiful lady slash friend. She's 38 with an AMH of 0.05. But you out there, you know who I'm talking about. So I'll just use 40 as a group because it's just easier. So let's just forget about about that. Just let's forget about your age. What are some of the things that you can do? Okay. One, work on yourself. All right. Work on yourself spiritually, mentally, and physically. Something as simple as changing the way you eat could be astronomical. A small change here and there will add up. Okay. Your body is designed to heal itself. Your body wants to work optimally, and optimally means being fertile. Okay. That is being youthful. There's no reason why you can't try to use your own eggs even at an older age. So, diet, basics, diet, sleep habits, toxicity habits. What does that mean? Sleeping, say, 7 to 9 hours a day, okay? And eliminating toxins. What are toxins? From the deodorant you're using to the beauty products to your environment, smoking, drinking, pesticides, okay? So always try to buy the cleanest, most organic food that you can access. All right. Just keep your environment clean. Toxic people, toxic relationships, anybody that is not encouraging and supporting your project should not be part of your life at this moment. They don't understand. That's okay. You can love them from a distance. So all that said, that's the basics. Then let's talk about supplements. Something as simple as supplementing your body with the right nutrients, it's going to help your body bounce back and work in a more optimal way. So some of you out there are like amazing. You actually teach me. So there's CoQ10, okay? Male and women help with ovarian reserve, and in males is huge for motility, okay? Vitamin D, crucial for both men and women, all right? I know DHEA is a big one out there, but it is a hormone replacement. DHEA is a testosterone produced by adrenal gland, all right? Testosterone is mostly produced by the ovary in women, while the DHEA is mostly produced by the adrenal gland. So I would recommend testing first because it's actually hormone replacement. So if you're low, go ahead and replace it, okay? But too much of a good thing is a bad thing. If you go overboard, not only are you going to have acne and lose your hair, you're actually messing up your ovaries. Gland therapy, that's huge. I use it a lot. Some of you that work with me all the time, you know, if you have ovarian issues, eat ovary. If you have uterine issues, eat uterus. I personally use a company called Standard Process. Is one that I use personally. I give to my family, so I just share it with my patients. But there's a few out there that are, thinking they're aligned with that thought process that are great and doing the same thing. Not only it's like having a replacement. It's like having a Ford out there just sitting there for your car to have the exact pieces. But not only it helps with that, but it also helps with uh, providing a blueprint for that organ to work better. And it provides something called oral tolerance therapy. So it's kind of having an oral vaccine in favor of the organ you're trying to heal. All right. Your immune system is 80% mouth to anus. That means that if you put a little bit of ovary in your mouth every day, it's going to desensitize your body to attack your sick ovary. So it allows it to heal. Makes sense, right? So personally, I use a lot of gland therapy with my decreased ovarian reserve patients to protect the ovary while we come with all of these other modalities to help it heal. All right. We've talked about LDN at times. What does that do? Naltrexone is a medicine that is used to counteract opioids, your morphines and Percocets and, stuff like that. But it's also being shown to help as an anti-inflammatory medication and kind of like an autoimmune type of stuff. So it does help bring that down as well. So then with this and that, you see how it all adds up. Don't lose hope, okay? And then you have PRP, which I am a fervent believer and lover. So platelet rich plasma that is used in multiple areas of medicine to kind of help facilitate this process of anti-aging and accelerated healing. I've had multiple patients, especially in the perimenopausal, kind of an early perimenopausal stage. They're still having cycles or irregular cycles, and we have been able to correct that, and they have gotten pregnant spontaneously. In the group of patients where you have that decrease of ovarian reserve scenario, you not necessarily jump to IVF. I know IVF is choice, is great. But what I've seen is these are ovaries that are producing eggs. That does not necessarily mean they're abnormal eggs, but they might be frail. Okay. And you're taking them out of the body and putting in a lab, and they might not survive or fertilize, etc. But if they're kept in the body where they belong, they might just need a little bit more loving. And so I am moving more towards hyperovulation with IUI on this age group. And I'm personally working with a large group of patients that have failed IVF because they have decreased ovarian reserve. You get three eggs out and maybe one embryo or zero. And then what about hyperovulation, especially if you have one or even both of it, fallopian tubes that are working, and then you hyperovulate, okay? You purposely use IVF meds to get 3, 4, 5 follicles that could produce an egg, and then do IUI and or time intercourse. And then out of those eggs, yes, it does increase chances of twins, but then it also increases chances of pregnancy. All right. Especially if you do priming. We talked about human growth hormone. We talked about ACG. Okay. I have a patient right now, beautiful lady from New York. She did not do so great on ACG, but she's doing great on low dose. I'm sorry, on Omnitrope human growth hormone, and she's actually priming with low dose ACG and doing fantastic. And there's always the question of stem cell therapy. It's not legal in the United States, but what about that? I mean, we are designed to heal ourselves. We're designed to live longer. I mean, you look at some of the ancient books and information out there, and we used to live more than 100 years. I mean, and then we can talk into the Bible and Sarah and Abraham and how they had children in their hundreds. So are we evolving or devolving? That's a big question. I'll just put it out there. Okay, I just wanted to bring it up. Okay, embrace it. Don't be ashamed. Don't be I know that it's hard to face social stigmas. It's okay. All right. Whatever. It's your life. You only live once. So YOLO. All right. You only live once. Don't have regrets. And if it's in your heart to expand or have a new family, what if you met the love of your life at 42? All right. There's nothing wrong with that. Um, and there are many, many choices. And IVF with donor eggs are it's always going to be a choice. You know, most donor eggs are young. There in most fertility clinics, there's an age limit of who can donate the eggs. That choice will always be there for you. But if it's in your heart to try with your own eggs, then go ahead and do it. Okay. Allow yourself to go through this process. Maybe one, you will follow that miracle and you'll be that one person that breaks the envelope. And if that's not going to be your history, then, maybe donor eggs will be your thing, but that choice is there. So I know that a lot of you out there are thinking my clock is ticking. It is and it isn't. It is and it isn't. Just take a breath and do the right thing for you and your family. Alrighty. Um, I know that you have 100 questions in here. So let's see. I am 49 and people say I'm nuts. I get you. It's okay. You don't have to be apologetic. And no, that's right. You're not nuts. You're 52. It's okay. Sometimes life puts us in places where it's not the right place, it's not the right partner, it's not the right situation. Um, and we're late bloomers. Do not be apologetic for it. Own it. It's your life. It's okay. We did all of these changes over 2 years and still miscarry. It's misleading to tell women over 40 that all that can change with expensive lifestyle changes. Elizabeth, I respect you. That's great. I think that this is a very personal journey. I've seen a lot of 40 plus women have babies. That's what I do day in, day out. It might not happen for everybody. That's why I said, IVF with donor eggs is always a choice. And there's a point where if that's going to be your choice, you'll know when to make that transition. Um, but I don't think that me sharing love and hope for everybody else out there that is not ready to make that transition is wrong. And it's personal. I mean, I see people that are ready and they're like, I don't want to deal with it. but it's something so deep and personal that I think everybody should have the chance to go through their own process and get to donor eggs at their own space, at their own time. And knowing that there is going to be stressors and expenses involved with this. I spoke to this lady today. She's 38, AMH of 0.03. And she's not ready. She's emotionally, physically, spiritually not ready to make that donor egg transition. And my conversation with her was, you're seeking a miracle. You are. But I want you to understand, we might succeed at the miracle, but we might fail. And there's going to be some expenses. And you can't, either you say, I'm done and I go into IVF with donor eggs, or I'm going to try. I'm going to try this one time, this two times, because I'm not ready. And I don't want to live with regrets in my heart. She chose to try. And we're going to try. She's going to try to do hyperovulation with medication and the priming and the diet and all that crap. And I honor her for that. That's right, Nancy. It's not one size fits all. And supplements does change my ovarian reserve. Me, Maribel, my ovarian reserve was 0.2, and I'm taking the stuff that I'm telling you to take. My ovarian reserve is 0.45. It works. All right, all right. ACG, Liz, it's ACG. So there are different things. A lot of this is experimental. A lot of this is coming from the anti-aging, cosmetic world, and then we're just bringing it into fertility. Why do we bring it to fertility? Because your outside tissue, it's called epithelial cells. Okay, this is the epithelial tissue. So if it works for your skin, it's going to work for your ovaries, because your ovaries are specialized epithelial tissue. Okay, so then a lot of the stuff starts from the cosmetic world, and then it's brought in. So then ACG was started with like weight loss and increasing metabolism, but it's also because it's anti-aging, and some women do better on the ACG, the ACG diet thing. So you inject yourself with low dose ACG, and some women do better than Omnitrope or human growth hormone. All right, all right. When dealing with the option of donor eggs, is it an option to freeze our own day 3 and have frozen day 5 donor? Absolutely. I would not transfer them together, Fallon. I don't know what your age is, because older eggs, again, they might just be frail and not abnormal, but they do better on day 3. They do better the least amount of time outside your body. They actually do better. So if you have day 5 donor eggs, you would have to actually grow out your eggs, and I wouldn't. So I would just transfer yours first, and put it in the divine hands, in the universe hand. And if that doesn't work, then go for donor eggs. A lot of ladies that I talk to, I do talk about the combo package. I think that's an awesome package. Meaning, if you're ready to move into IVF and other choices, you can go through IVF and add some donor eggs to that. Okay. So at CNY, you do IVF on your own, the donor package, and then donor eggs 100%. So the donor package, you actually add extra eggs, and then you fertilize your own and the donor at the same time. And that gives you like a plan B. right? And I think that's awesome for a lot of you out there. So I would start with yours first, and then if that doesn't work, then go into the day 5 donors. How does somebody view donor eggs data bank at CNY? You have to become a patient and then you get access to the data bank. Hyperovulation with IUI in older patient? Yes. Right now I'm working with a 38-year-old with an AMH of 0.3. And then what we do is um, you use, IVF meds. So she got triggered tonight and she had 5 follicles that could potentially do eggs. It does increase chances of multiple, but it also increases chances of pregnancy. All right. What are the supplements? So you want to get a prenatal vitamin that is food-based. There's a few out there. Garden of Life is one of my favorite. I like a company, it's called Nutritional Frontiers. It's a prescription, so it's not sold out there, and it's food-based. So it has a food-based to the a few additional ingredients. A lot of uh, prenatals and vitamins out there, they're synthetic. So, and when you look into the science behind that, when you are actually manufacturing a vitamin, and it's not food based, it doesn't come with all of the cofactors that help that one vitamin work. All right, it's an isolated, thing, and it doesn't at the end help you very much. So I like a food based prenatal. Vitamin D is very deficient, especially on states or areas where there's a winter, so you stay more inside, and so you don't really produce your own vitamin D. Vitamin D is produced on the skin with sun exposure. Glandular therapy, meaning ovarian tissue, ovary tissue, pituitary tissue. So I use a company called Standard Process. It's also prescription level supplements, and I like a supplement called it's a package. It's the female endocrine pack. And why do I like it? It's simple. It has support for the pituitary, hypothalamus, adrenal, ovaries. It does have omega-3, current seed oil, and a whole food vitamin. So it's like an easy package, and it will support the whole endocrine system. I sometimes add uterine support to that, and sometimes we'll add immune support depending on the case, or even spleen. In the naturopathic world, supporting the spleen is very important because the spleen takes care of inflammation, adenomyosis, and endometriosis. So if I had 2 kids earlier and missed miscarriage at 41, probably due to chromosome anomalies, do I have higher chances with PGT tested embryos that women didn't? So yes, you do. PGT testing is the best technology we have. It does have um, its kind of drawbacks. It is controversial. First of all, you do need to have day 5 and beyond embryos to actually be able to biopsy the embryo. Okay, and a lot of times, women with low ovarian reserve, their embryos don't really make it to day 5, and if you push them, you might lose a few or even all of them. So it's a complicated thing now, and then results themselves can be complicated. You can have 100% normal embryos, and you can have the mosaics that makes it complicated, and then the very abnormal. The very abnormal are very clear. The normal are very clear. The mosaics is where it gets kind of, what do we do with that? Because some of them will self-correct, and then a normal PGT tested embryo does not guarantee a pregnancy. I've seen many ladies out there go through genetic testing, and then they fail the pregnancy, and then they go, what the hell happened? Well, not having a normal a normal embryo guarantee a pregnancy. It's not that straightforward. Okay. So it's a lot to think about. Is some of you out there want a more specific, because with the supplements I can kind of share a few, but if you're if you want, I tend to be specific to that one person's needs, so I can't just throw everything out there for you. You're always welcome to reach out to me through Messenger. My is the best way to reach me. My name is Maribel Verdiales, and you can do it through Facebook Messenger. If you want to discuss your case with me, you're welcome to do that. Just send me a message and I'll get you on the schedule. Can you comment on the information given in It Starts with an Egg book? I love It Starts with an Egg. I think that the lady who wrote it, I read the book. It's very good. I agree with most of the stuff in that book, including how she addresses DHEA. So it's a great book to start. A lot of, I would say 95% of the information out there in that book is pretty accurate. Can I prime with Omnitro for 3 months? Is that too long? That's perfect. I don't recommend people to prime longer than 3 months. Omnitro, human growth hormone, it is experimental in the fertility area. There's some debate on it. So, but yes, I usually recommend people with any issues, decreased ovarian reserve or decreased lining, or fail IVF, to kind of stop and give themselves 1 to 3 months of priming before they continue with their therapy. I don't want to live with regrets. I had an interview with Dr. Keels. I'm still trying to save enough money, and then will be. That's right. That's right, Julie. Um, the way I describe the fertility journey is this is a journey. This is a marathon. It's not a sprint race. It is definitely not a sprint race. In my career, I've done this for 20 years. I have not seen that quick fix. It's just 90% of the time it's just not a quick fix. You have to keep your eyes on the prize, and you have to follow your heart, and you have to go through the process. No matter how old you are, what your circumstances are, if you're in marriage number 4, and this is what your heart desires, you have to go through the process. Again, donor eggs, it's there. It's a choice. Amen for those ladies. God bless them all, because I think that's pretty amazing that they're doing this for us. Um, but emotionally and spiritually and psychologically, you need to be ready to make that transition, and understanding that miracles require radical measures. So if you want to do that, you should be honored, you should be respected in your decision. You should not be mocked and thrown to the corner because you're 45 and trying to use your eggs. You should be given a chance to try. You should be given a chance to fail. It's okay. You are entitled to fail and say, all right, they were right. I should do donor eggs. It's okay. There's no shame on that. There's absolutely no shame. The worst question is the one that's not asked, and the worst try is the one that's not made. Ceravidal. So Ceravidal is a combination of amino acids that it's supposed to stimulate your body to produce its own human growth hormone. There's a few studies, most of them by the same company, sponsoring Ceravidal. It's definitely not going to hurt you. All right. So it is definitely worth a try. What does metformin do prior to egg retrieval? So metformin doesn't work for everybody. Metformin is really, really for the the insulin dependent PCOS crowd. If you don't have those issues, metformin is probably not really going to do much for you. Once you have a known donor, you they become a patient. We want to make sure they're okay, and then that person go through the IVF process, and you're the recipient. We do that a lot of times, even with same sex couples. What dosage of vitamin D? I usually like to load people at 5,000 of D3, and then depending, I'll keep them there until they're normalized, and then you can bring them down to maintenance to 1 or 2,000 units. Is there a way to get a supplement list? I don't like giving a supplement list because every one of you is unique. I like to look at your chart, look at your specific scenario, see where the deficiencies are, where some of the loopholes are, and then design a program that's specific for you. Vitamin B support, vitamin B complex, food-based. Again, I can't be emphatic enough. It's very important for the liver. And then you indirectly support the endocrine system because the liver is the one that processes hormones. So if the liver is not working well, your hormone ratio is going to be off. All right. All right, ladies. Well, time's up. And gentlemen, you all be very, very blessed out there. I am Dr. V again, V as in victory. I'm the Atlanta doctor. And you always welcome to reach out to me at the Atlanta office. Otherwise, I'll see you in cyberspace in about 2 weeks, okay? Have a blessed rest of your week.